nearly 16 million adults experience persistent or chronic low back pain. That's a staggering number. And you got to ask yourself, with this commonality of a pain and dysfunction, can we be doing something better and more proactive? So in this video, I want to discuss 3 simple but effective exercises to improve the source of low back pain. Not to treat the symptom, not to feel good for an hour later, but to help you with 3 basic exercises get out of lifelong pain. So if we're looking to get out of a lifelong low back pain cycle, we first need to understand the approach and where we're coming from. The easiest way that I can help you understand this is by thinking of a house. If you had a second floor problem and you fixed the second floor, and a week later it came back and then you fixed it, and then a week later it came back and you fixed it, and a week later it came back and you fixed it, and so on, there would be a certain threshold that maybe you'd stop and ask, maybe this isn't a second floor problem. Maybe something is going on foundationally, underground, that I can't see. And once you get a contractor out there and you figure out what's going out from a foundational standpoint, you see that it's cracked, it's leaning, something is going on structurally at the foundation. Once you fix the foundation, the second floor problem goes completely away. Why? Because the second floor problem was never a true problem. The same can be said with our low back. The low back is a symptom that is caused from a foundational weakness, asymmetry, dysfunction. So just like with the house, when you fix the foundation, you fix the first and or second floor problem. With the human body, if you fix the foundation, you fixed the first or second floor problem, aka low back pain. Now, you might be asking yourself, what is the human body foundation? Great question. The human body foundation is the pelvis and the rib cage. And so often, they're in such a poor position that the low back has no choice but to follow, has no choice but to pick up the slack, has no choice but to get strong and start doing all the work. Not only is it doing all the work when you are moving, but we also start to develop breathing dysfunction because of the position that the foundation's in. So that means in order to fix the source of low back pain, we actually don't focus on the low back. Instead, we focus on the foundation, we focus on breathing. So that means to fix the source of low back pain, we are going to choose 1 breathing exercise, 1 pelvis exercise, and 1 rib cage exercise. So our first focal point is breathing. We need to establish a new breathing pattern. And you might be asking yourself, why does breathing play a role in low back pain? Well, our big time breathing muscle is the diaphragm. It sits under this rib cage and really follows the border of the rib cage. What a lot of people forget or don't realize is that the diaphragm is directly attached to the lumbar spine. So when we don't have efficient breathing strategies and utilization of the diaphragm, we start to use the low back. The low back helps to essentially pull air in. We start pulling on that low back. We start using it to move the rib cage. We start using it in a lot of different compensations. So because of the attachment of the diaphragm, and the diaphragm being our big muscle, we need to make sure that our back is not working 23,000 times per day. Yes, the diaphragm contracts over 23,000 times per day, and if the back is in a leveraged position to do so, it will assist with respiration. So now that we understand why we want to fix breathing, let's talk about the strategy. So we already introduced the importance of the diaphragm. Now we're looking to utilize it. The goal of this is rib cage mobility. Most people that have low back pain have a very stiff rib cage and it's not moving. And again, that diaphragm contracting over 23,000 times without it working efficiently is going to cause problems. So I don't want to overcomplicate this, but I want you to think about a couple of things when you're doing this. Number 1, we're going to go in a hook-lying position and grab a balloon. The typical breathing pattern of someone that's in low back pain is that they usually do way too much belly breathing, and This is a result of a rigid rib cage. The rib cage doesn't want to expand and compress. It's rigid, so we move where we have the space to do so. So when we're in this position, we want to use a balloon. Why? Because a balloon is just like a dumbbell for our abs. If you want to work your biceps, you get a dumbbell and you do bicep curls. If you want to move your rib cage and increase the amount your abs contract, you grab a balloon. From here, I just want you to think about two things. Exhale and feel the rib cage come down, and inhale, maintain that position. And we want to see chest expansion. This chest expansion, aka rib cage moving, is synonymous with your lungs expanding. People with low back pain usually don't expand their lungs nearly enough, and we have to compensate for it. So here's what we're thinking. We're going to take the balloon in. We're going to take an inhale through our nose, exhale through the balloon. We're going to go down. We're going to hold this position. We're going to inhale, maintain a downward position, and expand here. Next, we need to focus on the pelvis. What I want you to do is to grab a box, a bench, a chair, a windowsill, anything that you can be in this 90-90 position. So you see we have 90 degrees at the knee, 90 degrees at the hip. Make sure your head's supported so that way your neck isn't kicking in. From here, I want to focus on two things: the position of the pelvis and the hamstrings. Let's start here at the pelvis. You're either going to have too much space or no space. Most people live on the side of having too much space, and what we want to do first in this situation is imagine we have a big belt on and we need to use our hip muscles to roll the pelvis or roll the belt buckle towards our chin. You should feel the low back flatten when you do this. If you're living on the other side and you're way too rounded and way too flat, think about using the hip muscles to move the belt buckle towards the feet. What I don't want you to do is to force things. So I don't want you to force your ribs down so that you flatten your low back. We didn't actually roll the pelvis in that situation. So really get comfortable with moving the pelvis forwards and backwards. In this position, it makes it a little bit easier to feel that motion. Once we have that and we have this neutral position, then I want to work the hamstrings. Now, it's an isometric contraction where we are working on grading muscle. It's not like a trigger where it's all or nothing. We want to think of a number scale, 0 to 10. 0, no contraction of the hamstrings. 10, maximal. What we're going to do is we're going to go in and find that neutral position where we feel that low back just touching the ground. Then we're going to pull the heels back in our shoe, and imagine you're sliding your foot to your butt, but you can't because something is blocking you. And what you should start to feel is the hamstrings come on, and I want you to think of going from a 0 to 1, then pull down on your shoe more, 1 to 2, pull down on your shoe more, 2 to 3, and continue to build how much we are going here. Now, as you do that, you might find you're starting to arch. So I'm asking you to think of two things at once. Maintain your pelvic tilt as you start to grade your hamstring contraction. Once you get to 7, 8, 9, maybe even 10, then start to slowly go back down. You shouldn't feel any low back pain at any point. If you do, we need to check our position of the pelvis. Did we lose it? Or are we forcing the hamstrings? We might need to back off a little bit. Once you're in this position, then try to get breathing going. Don't use the balloon, keep it simple, but see if you can hold those hamstrings, hold your pelvis, and take a breath. And feel the chest expand. And so we're starting to incorporate the breathing now with our pelvis. And finally, we need to get the rib cage moving. Remember, a rigid rib cage equals dysfunction. For this, I like to do a shoulder blade push-up. And this is just a twist on a cat-cow or cat-camel, whichever wording you prefer to use. So we're going to go through shoulder protraction, shoulder retraction, but instead of doing the full body like we see in the traditional cat-cow, I want to really emphasize just the rib cage and minimal movement of the pelvis. The goal here is rib cage movement, protraction, and retraction of the shoulder blade. So let's talk about how we do it. You can set up in an all fours position, and you can do it from here, or you can start here and drop down if you need to. From here, it's pretty straightforward. We're going to keep the elbows straight.